Hello everyone, I am Dr. Shankar. As many of you are expecting rapid recall session, many of you are also waiting to match all the 200 question. Now I will go through all the question in a rapid fire manner so that you can match your answer. This is totally recall based question, recalled by some of my juniors. If I am wrong, do correct me in the comment section. I will just point out the clinical clincher and answer in upcoming 4 videos. By today 9 pm I will cover all the 200 questions, so stay tuned for the next 4 videos, each video containing 25 questions. So this video will contain question number 101 to question number 125. So starting with question number 101, one question was there about epidemiological study. I think aniline dye worker related epidemiological study was there among factory worker and the worker and among those officer who are also working in the same industry. So some history was taken. So that was actually description of retrospective cohort study. So the epidemiological study of aniline dye factory worker and office worker between with history is retrospective cohort study. Next question was one image based question. Nasopharynx posterior rhinoscopy image was there, and the structure marked was fossa of Rosenmuller, a depression just behind the torus tuberis, that was fossa of Rosenmuller. Next question was, I think, what image based question. A child came with fever, and I think one image was there, either lymphocytic infiltration or aniscousal or Ashop body image was there. So child with fever, Ashop body image, probable diagnosis is rheumatic fever. Coming to next question 104, nerve action potential, and the mark point denotes refractory period among the nerve action potential BE. Then male patient with clean wound came to hospital who received tetanus 10 years back. Management of this wound will be tetanus single dose. Who has taken or received tetanus 10 years back, for clean wound it will be single tetanus dose. Coming to question number 106, diabetic patient, pain in the buttock, no gas gangrene. I think it is probably necrotizing fasciitis. Next question about the true or false. I think question was there about ARB, angiotensin receptor blocker. Among the option, which one is true statement? The true statement is losartan is thromboxane A2 antagonist. So losartan has TXA2 antagonistic action. I think other options are like telmisartan undergoes renal clearance, wrong. Irbesartan undergoes hepatic and renal clearance, candesartan undergoes renal clearance, etc., etc. But the correct answer will be losartan is thromboxane A2 antagonist. Next, management of decay in a child. It is normal saline 20 ml per kg with gaps after some time after giving normal saline followed by 0.1 unit per kg insulin. I think this is the answer. This is also controversial question. I don't actually, so many of you are giving so many options to me, so it's also very much controversial, but I think normal saline first 20 ml per kg followed by regular insulin 0.1 unit per kg stat dose. So management of diabetic ketoacidosis in a child. Next, coming to question number 109, liver abscess. I think patient was presenting with fever, chills and rigor, right, hypochondrial pain. You have done one USG. On USG or CT 75 cc collection was noted. While with what will be your initial management? Medical management with metronidazole tablet. So metronidazole tablet 800 mg TDS. So liver abscess, medical management first. Then I think next question was about lockjaw. A student in the afternoon class was whining, suddenly got stuck in open mouth. That was typical history of lockjaw. I think question was asked about the muscle inserted in TM joint, that is lateral pterygoid muscle. Coming to question number 111, ductus arteriosus was marked. As all of you know, arch arteries 3, 4, 6 artery, distal part of left 6 artery, this part will form actually ductus arteriosus, 6 artery. This is 3, 4, 6. So 6 arch artery forms ductus arteriosus. Next, coming to question number 112, subarachnoid hemorrhage patient, BP 160 by 100, I think near about so. So next step, is it pneumodipine or CT angio? It depends on the patient clinical profile. What was the BP? This is also controversial. It's up to you. If the BP is very much high, patient needs to be stabilized first with medicine, and otherwise you can go for imaging to look for the aneurysm. Then I think one spirometry graph was there, and the marked point in and the marked and the question was asked what is the marked point. So that is FRC, functional reserve capacity. So this is the FR, I think spirometric graph image based question was there, IBQ. So image based question, FRC was asked. Then I think one blood transfusion related question, after blood transfusion bilateral crepitations was found. What is this? This is transfusion associated cardiac overload, TACO, or fluid overload. Next, coming to question number 150, elderly patient, decreased far vision, no need of near glass. This is example of index myopia because of cataract, index myopia, nuclear cataract. Next, CS elderly female, CSR weeks involving pelvic wall with necrotizing lesion. What will be the management? It has already involved the pelvic wall, so the management will be chemoradiation. No surgical management is possible because it has already progressed so much to chemoradiation. Pregnant female, fetal parts not felt well, probably due to polyhydramnios. Then image based question, allantois remnant. So allantois remnant of allantois is a median umbilical ligament. Then I think one question about bite followed by bleeding, discoloration, snake bite or viper bite. Bite, if presents with bleeding, it is viper bite, or bite along with some, if neurological features, then you have to think about cobra and all. Then next question number 120, direct hernia, structural defect of which structure are more prone to develop direct hernia? It is conjoint tendon that forms posterior wall of the inguinal canal. Then one image based question was there, though I don't know the what is the exact question. It is bipartite patella. Then one question about carpal tunnel syndrome, Darkan's compression test. I think question was there, I don't know what the actual question was asked, but probably it was about carpal tunnel syndrome and Darkan's compression test. Do comment in the comment section what was the actual question. Then cardiac phase potential, changes in phase 2, what is the basis of phase 2? It occurs due to calcium channel opening, phase 2. Ectopic pregnancy, stable patient, 3 into 2 centimeter, HSG 2800. What will be the management? Medical management, stable patient, methotrexate single injection. And last question of this session, tap water collection back for bacteriological testing. What are the protocol? So is better to, before taking the sample, let the water flow for at least 1 minute or some minutes. So before taking water, let the water flow for at least 1 minute. Other options are like take sample from gentle stream of water to avoid splash, or keep the bottle near tap to avoid splash, take sample from water tap which are leaking. Those options are wrong. This is the right option. Before taking the sample, let the water flow for at least 1 minute. So this is right option. In the next session, I am going to discuss question number 126 to 150 in a rapid fire manner. So stay tuned for the next video in upcoming hours. Okay, thank you very much.